Well, let's talk about some of the key issues being raised in the country today on COVID-19, where we are in the curve, the shortage of equipment, possible scenarios. Dr. Isaac Bogoch is with me again this morning. He's a physician and infectious disease specialist at the Toronto General Hospital Research Institute. Dr. Bogoch, I know your time's precious as we go through this, so I do really appreciate the fact that you've made more time to speak with me this morning. It's good to have you again.
Oh, thanks for having me back.
We are hearing our health and political leaders implore us to maintain those self-isolating and social distancing measures. Why is that so important at this point in time?
Yeah, so certainly we're still seeing a greater number of cases day by day. We're not seeing the curve flatten in many provinces, for example, in Ontario. And we know that if we continue along this trajectory, we're going to be in trouble. We're going to start to see more and more people come into hospital. We're going to see more people in intensive care unit settings. Sadly, we're going to see more deaths. And we really need to flatten the curve. And the way to do it is by spreading apart and blocking community transmission. It's as simple as that. If we all adhere to this, we will slow this down and we will be okay. If we don't adhere to it, we're going to be in trouble.
All right. When people see these big spikes in some of the provinces each day, why shouldn't they get discouraged?
Well, I mean, it takes a bit of time for anything that we implement to actually seeing the results of this. So it's going to be a minimum of 2 weeks from the time we actually start to really, truly physically distance ourselves to the time where we'll start to see a slowdown in the number of cases. And I think I should also factor into that it's kind of hard to interpret these numbers because many places have simultaneously been expanding diagnostic testing. And of course, this is the kind of virus where we know that the more we look for it, the more we find it. So, it is kind of hard to interpret the diagnostic testing over the last couple of days because there's been a greater number of new cases, but there's also been a greater expansion of testing. So really, the pattern over the next week and a half to 2 weeks is going to be absolutely crucial to determine where we are on the curve and how well we're doing getting this under control.
All right, there's lots of discussion and debate now around possible scenarios. We've seen the numbers in the U.S. from the White House there and the health experts in the United States. But in this country, our political and health leaders seem a little more reluctant to put it all out there for Canadians to see maybe just how bad it could get. What do you think of that strategy?
My personal bias is that I'm all for transparency, even radical transparency. I think it's important to share the good news, but it's also important to share the bad news. And I think these are important messages to parlay to the general community. And I'm not here for fear tactics or scaremongering. I just think if this is communicated, we can have an honest discussion about where we are now and the various trajectories that we may take, both positive, negative, and sadly downright frightening. And we don't have to look that far south to see what can happen into a place like New York City. I really don't think that's going to happen here in Canada. I think our healthcare system and our public health system is more robust. But of course, we don't even want to come anywhere near that. And if we can do anything we can to avoid situations like that, we should. And we know what to do to avoid those situations. We just all have to buy into physical distancing measures.
Yeah, and I'm sure you've seen scenarios, or maybe you know them yourself, and maybe you worked on them yourself. Sure, you have. But what should Canadians be told to make sure they understand the challenge we all face? Should it be more than we need you to do this, need you to do this? I mean, there's the school of thought that if you put the numbers in front of Canadians of how bad it is, it might actually shock them into doing more.
Yeah, I mean, in all fairness, I firmly believe that more data, when it's placed in the appropriate context, is the right move. Like I said, I don't believe in fear mongering. I just think we should have very open and honest discussions about how we're doing and about the various paths that we may go down. It's no secret what we need to do. I mean, we've heard this from every senior health leader in the country and almost in all the provinces and in the municipalities. We know what to do. There's no excuse not to know what physical distancing means. There's no excuse to, get into large groups or start, hanging out with people. We know exactly what we need to do, and it's just a matter of buckling up and actually doing the job.
The Federal Health Minister, Patty Hyde, has acknowledged the government's stockpile of personal protective equipment probably wasn't enough at the outset of all of this, and that's why we're scrambling now to buy or manufacture more equipment and supplies. What's your view about whether we can actually get what we need in time to deal with the worst of this?
I'm pretty upset about this, and I've actually been rather vocal about this. There's no excuse. We knew this was coming 2 months ago. We knew supply chains were disrupted or going to be disrupted. We had ample time to plan for this. I know there are solutions now in place. For example, working with local industry in Canada to help produce or help procure these materials. I think that is fantastic. That is fantastic. But when you think about it from a healthcare standpoint, you really need to know what you're going to be getting and when you're going to be getting it, and know that you have a steady supply of it. And then and only then will you be able to adequately manage your resources, because we know we're in this for the long run. This isn't going to disappear in a day or two. This is going to be going on for months and months and months. So
Right. And
it's extremely important.
In your view, is that still a major challenge today? Because we're going to hear, we're hearing more about how the equipment's on its way. It's coming. It's coming. Could be days, not weeks. Could be weeks, not months. If you're hearing that, if you're on the front lines and you hear that, are you encouraged, or are you, well, what are you doing?
Well, I mean, I think there's a couple of points. One is that I'm really happy that this is being taken seriously and that this is being addressed, and that, it doesn't appear like this will be a long-term issue if we go by the word of what our senior leadership is saying. But on the other hand, let's see this implemented, and let's see this implemented now. And at the hospital front, what the hospitals really need is, obviously not just a one-time donation and a one-time supply, but transparent communication about, here's what we have for you, and here's what the supply chains are. Here's how much you're going to be getting over time, so that the hospitals can really plan accordingly and know how much of this they can use and how much of these PPE they can burn through. If they know that there's a steady supply and a stable supply chain, I think they'll be able to do their jobs a lot better.
Okay, just a couple of quick questions to finish. We're seeing this disease now sweep through long-term care homes in Canada. There are reports at least 600 such facilities across the country have cases now, and so far, I think it's about half the deaths in the country are residents of those facilities. Why is it so hard to stop that from happening?
Obviously, this is just tragic, and it's just heartbreaking to see this happen. And we know that no one's immune from getting this infection and from transmitting this infection. And of course, we know that the elderly are the most vulnerable amongst us. It's not just the long-term care facilities. This is really permeating every aspect of Canada. And the issue is, when it does enter a long-term care facility, it's just painfully obvious, because we see people get very sick very fast, and we see transmission facilitated easier in those settings, just because there's lots of people under one roof. So I think it's just more obvious that it's there. But make no mistake, this infection is permeating every aspect of every part of Canada. We need to do. It's easy to say. It's easy for me to say we need to do a better job, but we do need to do a better job. And many places have strategies in place to help reduce this from getting, from having this introduced to these long-term care facilities. And many places have good action plans on rapid identification and isolation, but clearly more needs to be done.
All right, let's finish on this. What's your view of people who aren't infected or don't believe they're infected wearing masks when they go out in public, and whether that's a good idea, bad idea, and what strain that might put on the availability of masks for people who need them on the front lines?
Yeah, you got an hour? Obviously, this is a hot button issue. There's lots to say about this. Quite frankly, you're seeing two pretty extreme sides of this story. You see this very vocal pro-mask crowd, and then you also see, a little bit of dismissal, I would say, from the public health crowd. I think, like anything else, when you have two extreme views, a lot of the time the truth lies somewhere in the middle. I don't think that masks are going to be that helpful for protecting uninfected individuals from getting this infection if you are practicing social distancing, if you are practicing good hand hygiene. It may have some benefit, but if you actually stop and think about it, you should probably be wearing them at home, because this is where you are in the closest contact with other people. If you're practicing social distancing and you're practicing good hand hygiene, the masks probably won't be that. The incremental gain from these masks will probably be minimal when you're out and about in the world, and probably be most helpful when you're at home and in and around other people. The other concern is that there is often a false sense of security with these masks, and people have to appreciate that the masks offer maybe minimal protection. Their data is not solid on this, but there's certainly a lot more that goes into getting infected than just wearing a mask.
All right, Dr. Isaac Bogoch, always 10 minutes well spent and a chance to talk with you. Thanks so much again for your time.
Have a great day.